So, Tynwald, we're talking with Minister for Health and Social Care, David Ashford. Today you've come back for more money yet again, another year for needing more money. And obviously criticism from some that this is a constant thing. Every year you need more money.
It is, but the situation's improving. So the department has definitely required supplementary votes over the last few years. But we have actually, last year, my first act as minister was actually the supplementary vote last year, which was 9.5 million. It's 4 million this year. The amount has come down. And bear in mind as well, of that 4 million, 2.7 million of it is pay increases.
You got support from Treasury. Were you expecting so much? I mean, because obviously normally they'd be the ones that be, I suppose, tutting to some degree that you're going with the begging bowl.
Well, Treasury have been very supportive, and I'd like to thank the Treasury members for all the support they've offered DHSC over the last year. They knew it was going to be a tough year. We started the year with a £7 million improvement plan that we needed to deliver just at Nobles Hospital. So we were starting 7 million in deficit, I suppose you could say, before we even started the year. The fact that we've managed to get to an end of a year with £4 million overspend, and like I say, 2.7 million of that being pay awards, I think is fantastic. That all the staff have worked exceptionally hard to deliver efficiencies within their services to be able to get to that point.
You had your critics. Mr. Hooper notably was giving you quite a thrashing almost there, verbal thrashing.
Or to a certain extent, but I mean, like I say, with all due respect on a few things, I think Laurie's wrong. One of the things he's mentioned was about us robbing the community services to pay for Nobles. Well, as I pointed out to Mr. Hooper, in relation to mental health, they're probably one of the ones that are going to be overspent this year. But I think one important point to make about the 4 million is that £600,000 a day is the spend rate of the department. So the overspend that we are potentially calculating, and bear in mind the 4 million as a maximum, equates to about 6.5 days worth of service. So I think that's an important thing to put it in context.
What happens next? I mean, I said next. You are literally coming back each year, or do you hope to balance your books at some point? Fudge from one of your members going behind us there. I mean, was it fudged?
No. I think he's obviously thinking about what he's going to have for dinner. But in relation to that, no, I don't anticipate it to keep going. No. Keep going back. Like I say, we've got it down to 4 million this year. The aim next year will be for the department to be in on budget.
Have you got the right people in place up there at the hospital? Spending this money?
We've got an excellent interim director of hospitals. We've got additional interim HR support up there. The consultants' job plans are underway now. We're at the review of those. We've got a lot of dedicated, hard-working staff up at the hospital at all levels, from the ground the whole way up. Okay. And I want to thank them for all their hard work over the last financial year and for all the hard work that they're about to undertake in the new financial year.
Finally, was that an easier ride than you thought it was going to be?
It's not about easy rides. I mean, I'm minister for a department, and to be perfectly frank, if a minister's coming forward and saying, actually, we can't live within our means, we need more money, I would expect members to be querying, questioning and probing. Why is that? That's what Tynwald Court as a whole is there for, to probe and question. As a minister, I welcome it, and I'm delighted that there were so many members that did intervene in the debate.